Thank you, everyone, for joining us on this webinar this morning. We appreciate the time you're taking, and we know that you're all very busy, and we thank you for carving out an hour and a half to be on this important call, and we thank your leadership for allowing you to be on the call. My name is Michael Allison. I'm the Native American Liaison, Arizona Department of Health Services, and I'm giving the welcome and then a short prayer, and then after my prayer, I'll turn it over to Annika, who will give an overview of the agenda and a presentation, and then we'll start the presentation. And the main purpose of our meeting is to get input from our partners, tribal, urban, IHS, ITCA, on the next 5 years funding for the grant awarded to ADHS to start in 2022. So with that, I'll go ahead and offer the prayer. Shita bin lini bi kwa asaste akaha atso ko nan laiki do akwiche nikedi in anitso unlondo ni Jesus Christ benigent. So it is in. Creator, we offer our prayer up to thee this morning to give thanks for being with us and watching over us all the time for this beautiful Mother Earth we have to live on, for our relatives and families, our spouses, our children, our grandchildren, our grandparents, for the jobs that we have, and for the vaccines that's been made available for the virus. Pray that all those families who've been impacted by the virus or other illness, where they are in sorrow, that they would be blessed and comforted. And we pray for our tribal leaders and other leaders as they travel, working on behalf of all the people to make our lives better. And we pray for peace throughout the world. Pray that everything will go well with our webinar this morning, and we offer up this prayer humbly in Jesus' name. Amen. Okay, so thank you for allowing for this prayer, and we'll turn the time over to Annika.
Thank you so much, Michael, for the prayer. Good morning. My name is Annika Ishikawa, and I'm with Arizona Department of Health Services. This is the agenda for the meeting today. We have several presentations. The first is going to be from Renee DeChili with Arizona State University, covering tribal resources to address the harmful effects of heat events. The next is going to be from Ginny De La Cruz with ADHS, discussing a funding opportunity with the EPA. And the last presentation will be by our tribal liaison, Michael Allison, covering the 2019 Tribal Lands Meeting. This webinar is going to be recorded, and the slide materials will be available after the webinar to register participants. If you're having issues with audio, you can join through your phone. And some webinar housekeeping rules. Attendees are muted upon entry, so please remember to mute your phone and video when you're not speaking. And if you have questions, please use the webinar chat to ask us. So to start us off, please re-enter your meeting ID, followed by. The purpose of the EPHT program is to deliver information and data to protect the nation from health issues arising from or directly related to environmental factors. So a brief review of the EPHT program is that it's a tool to help Arizonans learn about the environmental health hazards in the state that could impact their health. EPHT was built on the idea that health and environmental problems are not always separate issues with unrelated solutions. EPHT has gathered information from national and local sources in order to view both environmental and health outcome data in one easily accessible place. For example, it reviewed air quality information and compared the information with respiratory issues such as asthma. So Arizona recently became a part of the Center for Disease Control and Prevention's National Environmental Public Health Tracking Network. As a result of joining this network, the Arizona Department of Health Services contributes data nationally and operates as a repository of state and local data. Through this CDC grant-funded initiative, Arizona also now has access to perform enhanced environmental surveillance, which is aided by an interactive tool that allows users to learn about environmental hazards in the state impact their health. So this is just a brief overview of the Arizona Tracking Program that was funded in 2017 and was one of 26 grantees. To address these needs, Arizona applied for the tracking grant to bring together environmental exposure and health data into one easily accessible portal, or the Data Explorer, as shown on the right. Arizona joined the National Environmental Public Health Tracking Network in August of 2017. We hit the ground running, collaborating with state and national partners to prepare and visualize their data in our Arizona EPHT Data Explorer. Currently, there are 400 environmental health measures and 3.8 million rows of data that are publicly available. To date, we've had over 50,000 data queries made in our Data Explorer. This is just a bigger image of what the Data Explorer looks like, and you can find this on our website. The second tool I want to highlight is our Quick Reports tool. This tool can be accessed from your computer, tablet, or phone. Users can type in their address and it quickly creates a report or a snapshot of some of the environmental health issues in your area. It uses the most recently available data sources and uses information at several scales like county, sub-county, and census tract. The Quick Reports homepage is a map of Arizona and an address locator. Users can zoom in to click on a geography on the map or type in their street address or city and zip code. We do not track what addresses are submitted. A box will pop up to select which reports you would like to view. Currently, we have 7 options such as demographic, asthma, extreme heat, heart attacks, proximity to highways, childhood lead poisoning, and most recently, birth defects or birth outcomes. Now I'm going to hand this over to Matt Roach to cover the funding opportunity and program updates.
Hi everyone, I'm Matt Roach. I'm the Environmental Public Health Tracking Program Manager. I'm going to be talking a little bit about why this meeting is a good starting point for an upcoming funding opportunity from the CDC. So if we go to the next slide. So as Anna mentioned, over the last 4 years, we're in a 5-year competitive cycle with the CDC for bringing together environmental data sets and health outcome data sets together and expertise for improving environmental health and doing public health actions. And some of the data that has led to public health actions included information on heat-related illness, safety, and on lead poisoning prevention, and we're going to hear a little bit more about that later today. So in this upcoming year, CDC will be putting out a funding opportunity for a 5-year grant that will continue the environmental public health tracking network. So bringing in new data sets, continuing on it, and building on partnerships to expand its use. So over the last few years, we have been building partnerships with tribal nations as well as agencies that support tribal nations through dialogue, and we recently hosted a workshop, which Michael will talk about later, and also tribal consultation and some other various webinars to get the word out about our program. Since we were the new people on the block, we would just try to build awareness. But where we see ourselves in this next 5 years is an opportunity to partner with tribes and provide dollars to get and build up environmental health responses. So we believe that we could work with tribes on a particular project, but we need to know now and prepare and plan for what that project would be over this 5-year period of 2022 to 2027. So generally, the CDC provides about $1 million a year, so about $5 million per jurisdiction. So in this case, last time the state of Arizona applied, we did not get $1 million. We only qualified for around $600,000, but that's still a good amount of money that we believe that could be split with tribes to advance issues that fall along this line. So I think we're going to have some discussion later, and I think this just sets the stage for how we could collaborate. And we have various expertise with epidemiologists, health educators, toxicologists to figure out an idea that could work. So for example, if there's a particular interest in drought or certain chemicals that are in the environment or air quality or toxins, that's something that we can figure out how to build around to define a project. And generally, CDC, for this upcoming grant, I believe they will post it on April of 2022. There's nothing out there right now, but I think we can build off of what they asked us in 2017. So if we go to the next slide, here you can see some of the dialogue that we held a technical advisory group with environmental partners, and we're hoping to continue having an advisory group, specifically a tribal advisory group that would meet at least once or twice a year to move projects forward. Next slide. So here you can see in the slides, I took a screenshot of the actual grant notice of funding opportunity where there's a activity that they defined, which is to initiate, maintain, and expand partnerships. And here it says to develop and implement a partnership plan and engage partners such as you see highlighted, non-traditional public health sector organizations as tribal nations, where awardees are expected to collaborate with key partners, including their state environmental agencies, and these established relationships may also benefit awardees by further enhancing their activities. So here, this is how you can see that tribal nations play into this grant. Next slide. So what are the benefits to tribes of participating in our technical advisory group? We'll be able to assist tribal organizations to develop environmental health capacity and assess tribal environmental health priorities within the grantee's jurisdiction. As you saw from the Data Explorer, it provided an opportunity to monitor various different environmental health issues. It also provides the ability for tribal leaders and administrators to access one main website for multiple environmental health issues. We know there would be a data sharing agreement regarding any tribal data collected in the tracking program, and we agree that this is something that we have to discuss further. But I believe there is opportunities to participate in environmental public health tracking without having to do data sharing if there become challenges of sharing data on the tribes. Tribal data can stay with the tribes, but I think there are technical assistance abilities and building up capacity that these funds can support. So we can think about it that way. Next slide. So that is a little bit about the environmental public health tracking program and where we see it going for the next competitive cycle, and just put it in your brain that we're planning to apply Arizona Department of Health Services in April and are just hoping to collaborate with tribal partners to make the best application to help the most vulnerable populations in our state. So I'll leave it at that and turn it back over to Anna.
I'm going to be introducing our first presenter, Renee, and she's a master's student in environmental and resource management department at Arizona State University. She graduated with a bachelor's in environmental earth science from Dartmouth College, and she comes from Cove, Arizona, located in Navajo Nation.
Hello, everyone. My name is Renee DiChile. So today I am going to talk about some of the strategies tribal communities in Arizona have implemented to protect the health of their community from climate-related hazards such as extreme heat and the resources that are available to tribal communities. And so some of the things that I will be covering are what facilities are available to help members keep cool, what types of education and outreach tribes provide, and what types of communication systems are in place. And so the information that I'm going to provide is based on, information that I was able to gather. And so I'm sure there's many more resources that are out there that are available to tribal communities. And so next slide. And so here's a figure showing the location of tribal communities in Arizona. There are a total of 22. And today I will be including information on 5 of the tribal nations, including the Tohono O'odham, Navajo Nation, Fort Mojave, Gila River Indian Community, and Salt River Pima Maricopa Indian Community. Next slide. And so first, I would like to begin talking about traditional methods and how the prior generation adapted to heat before there was such a thing called air conditioning. And so I'm going to provide a few examples of traditional coping methods of the Tohono O'odham and Navajo. And as with many indigenous peoples, plants were utilized to help strengthen the body and to help keep the body hydrated. In the Tohono O'odham, they utilize cactus roots, saguaro fruit, sap from mesquite and barrel cactus, which essentially just provided them with provided them like a source of salt. For Navajos, they utilize yucca fruit, and those are just essentially like tiny bananas. Wild onions were utilized, chokecherry, stomach berries, and also piña nuts from the piñon trees. And so in the past, the main sources of water came from springs, rivers, and washes. People would go down to the washes and dig holes to about 3 feet in depth, and they would collect water. The Tohono O'odham, they would store water in gourds or potteries to help keep the water cool. They also built what they call watos, which are essentially ramadas that are made of mesquite and octatello cactus stalks that provided them with a source of shade. The people also lived in adobe homes, and these types of structures naturally kept the homes cool during the summer. And to enhance cooler temperatures, people wet floors inside their homes. And similarly, the Navajo, they constructed shade houses, which they call cha'o, during the summer. And these are primarily constructed out of oak, with oak leaves covering the roof. And additionally, the Navajo people primarily lived in hogans, which were constructed utilizing cedar or ponderosa pine logs, along with mud. And lastly, the Tohono O'odham and Navajo were kind of known to migrate to higher elevations during the summer. And so today, many of these practices are still occurring. Communities still collect plants, are still utilized on the Navajo Nation. Some families continue to just the tradition of moving to the mountains to their sheep camps during the summer. And so now I'm going to cover some heat-related resources and strategies for 5 of the tribal nations. And I'm going to begin with the Tohono O'odham. So the Tohono O'odham have 11 districts, including a small community in Mexico. When there is a heat wave, the nation sets up cooling centers in the communities that need it the most. These are locations residents can go to cool off until it gets cooler. And other safe locations residents can go to during times of extreme heat are recreation centers. The Office of Emergency Management, they partner with the recreation centers to designate cooling stations. And senior centers are also locations that elders can go to during periods of extreme heat. And as for outreach and education, for many tribes, social media is becoming an ongoing source of emergency information, warnings, and public education. And through sites such as Facebook or Instagram, tribes educate the community on actions and resources to protect residents that do not have adequate ways to cool their homes in the event of extreme heat. And so the Tohono O'odham Office of Emergency Management have a Facebook and Instagram page where they provide education outreach on heat-related illness, climate change. They provide weather forecasts, and they also put out notices during an emergency event of when severe weather is expected. And in previous years, the Office of Emergency Management provided videos for extreme heat awareness. The office also provides pamphlets and brochures to community members on tips of how to stay safe during extreme heat events. And as far as climate change initiatives, the nation is in the process of preparing a climate change adaptation plan. And so moving on to the Navajo Nation. The Navajo Nation doesn't exactly have designated cooling centers. However, there are locations on the Navajo Nation that community members can go to, such as recreational and wellness centers, senior centers, and chapter houses. Chapter houses are essentially like community centers. There are about 93 senior centers on the Navajo Nation and about 110 chapters on the Navajo Nation. And again, social media, such as Facebook, is a source of emergency information. The Navajo Nation Department of Health Facebook page is a wellness page that provides valuable information related to public health. There are radio stations that do provide education and additional information for the Navajo people. The widely known radio station is KTNN. The KTNN broadcast covers the entire Navajo Nation. And then we have the K-Indian radio station, which broadcasts covers areas mainly in the Four Corners region of the Navajo Nation. And then we have the KGAK, which is just another radio station that covers much of the Navajo Nation. And these radio stations are bilingual, so they present in English and Navajo. And so for the Navajo elderly, the vital sources of outreach and education are CXRs, community health representatives, the CXR programs, and the senior centers. And many elders on the Navajo Nation, they don't speak or understand English, so these programs are essential in being able to effectively communicate with the elders. And CXRs, they provide home-based support, and so they go out to these homes, they meet one-on-one with their patients, and they just provide them with educational material and just kind of tips on how to improve their health. And senior centers, they also provide educational activities for elders, and they usually have presenters that come in to speak to them. And so chapter houses are another source of outreach for communities. This includes the elderly and also just other community members in the local communities. They usually have a bulletin board where people post information on a variety of things such as tips on how to stay safe during the summer. And so next we had the Navajo Nation Department of Emergency Management. They provide training on spot weather and extreme and heat and cold preparation. And as far as a communication system, the Navajo Nation, they do have an emergency alert system. And so I provided the link to where members can sign up. The Navajo Nation Department of Fish and Wildlife, they established a climate change program to spread awareness of climate change to the Navajo people. They provide educational outreach to the youth of the effects of climate change. They provide short videos that are geared towards K to 8th grade students. And they also have like pamphlets that includes like work puzzles and games and information on what climate change is and way to address impacts of climate change. The climate change program also provides information on projects that community members can implement, such as recycling program, water harvesting, gardening programs, and tree planting programs. And the climate change program also offers workshops, and they also have additional information that are available to the public as well. In 2014, a Considerations for Climate Change and Variability Adaptation on the Navajo Nation report was published to help the Navajo Nation on how to best adapt to climate change. And in 2008, adaptation plan was published by the Navajo Nation Department of Fish and Wildlife. So on the Navajo Nation, the lack of electricity is an issue, as it is with many other tribal communities. Approximately 15,000 homes on the Navajo Nation lack access to electricity. So to address this issue, the Navajo Nation has implemented renewable energy projects through the Navajo Tribal Utility Authority and Native Renewables. These two companies have provided off-grid PV systems to Navajo families. And the Native Renewables, they also provide these systems to Hopi families as well. And so moving on to the Fort Mojave. In Fort Mojave, the biggest cooling center is the Avi Resort and Casino. Residents know that if there's a power outage or if they need a safe place to go, they automatically know to go to the Avi Resort and Casino. And if needed, cooling stations are set up at fire substations and fire department substations and other available locations that residents can go to. Laughlin, Nevada, which is just outside of the Fort Mojave reservation. And so Fort Mojave, they educate their community and provide information through the Fort Mojave Indian Travel website and the Facebook page, and also the Fort Mojave Department of Emergency Response Facebook page. So these are two different Facebook pages. The Department of Emergency Response also conducts house-to-house campaigns by distributing literature, heat awareness. The Emergency Response Department, they have partnered with the Weather Service in that they get notices sent to them directly. And so once they get that information, they post that onto their Facebook page. And the Fort Mojave, they have an emergency communication system in place. It's called the Code Red system, which is used to send emergency notifications. If the weather is severe, they send notifications through the system. And it is downloadable through the App Store and Google Play. And moving on to the Gila River Indian community. So I was unable to identify if the community has cooling centers or if they set up cooling stations, though I do think they do have a system in place. The Gila River Office of Emergency Management, they provide essential information on how communities within Gila River can prepare in the event of an emergency. The website provides information on natural disaster preparedness that includes tips on how to stay safe during the summer, tips on how to develop a basic emergency plan, steps to take for family communication, and tips for an emergency supply list. The website also is provided or provides a weather outlook. And so community members can find information on weather utilizing this website. And so to enhance communication within the Gila River Indian community, the Office of Emergency Management has in place a reverse notification system for the purposes of providing emergency information over the telephone system. In addition, the Office of Emergency Management has established a hotline for providing real-time information to the public. Other sources of emergency communication or outreach include TV, radio, the Gila River Indian Community Facebook page, internet, which includes the travel website and the emergency management website, door-to-door campaign, the NXT communicator system, which is just a phone system that automates mass notifications. In 2015, the Office of Emergency Management published a multi-hazard mitigation plan that includes a risk assessment of all the natural hazards that could affect the community. This mitigation plan identified probable extreme heat impact and consequences. And the Gila River is also planning on preparing a climate change vulnerability assessment, as well as developing adaptation strategies. And so moving on to the Salt River Pima Maricopa Indian Community, the Office of Emergency Management, they do set up cooling centers if needed. These cooling centers can be set up at police or fire department substations. The Office of Emergency Management, they conduct community outreach all year to try to educate the community on how to be prepared for any emergency. They emphasize residents to be self-sufficient and to be prepared without power for at least 72 hours. The Office of Emergency Management also has a Facebook page that community members and the public can visit to obtain current information. And as far as emergency communication, currently the Salt River Pima community members can receive alerts and emergency announcements through several ways. One of which is through the Emergency Management Department. And these messages are sent to inform community members of local emergencies. And so if members want to be able to receive messages, they have to provide their information to the Office of Emergency Management. And then there are emergency systems and alerts that are available just to the general public. One is the community emergency notification system. These alerts are pre-recorded messages that are sent through the 911 database. And second is the emergency alert system, which are just sent through the television and radio. Third is the wireless emergency alerts, which are just messages that are sent through mobile devices. Alerts include extreme weather. Then there's the Ready Maricopa Community Preparedness mobile app, which provides weather alerts. This app also provides open shelter locations on tips on how to prepare for impending disaster. And so this app is free through the App Store and Google Play. And the Salt River Pima Maricopa Indian Community also have emergency response plan. They also have a hazard mitigation plan in place. And so here's just a list of additional sources that are available to tribal communities in Arizona. There are cooling centers and hydration stations in the Maricopa, Pinal, and Yuma County. So here's a link to the available cooling stations. Yuma County, they don't have an interactive map that Maricopa and Pinal County do. So I just included a link to the Yuma County Health District website that includes the location of cooling centers and water sites from 2019. So I'm pretty sure they still use these sites, but I'm not sure. And additional information and resources on how to stay safe during periods of extreme heat can also be found on the Arizona Department of Health Services, the Maricopa, Pinal, and Yuma County websites, the National Weather Service, the CDC, Weather Channel, AccuWeather, NOAA, Weather Underground. And so these are just places to find additional information. And also apps are available, the OSHA Heat Index app and the FEMA Weather and Disaster app. And so I just wanted to just acknowledge these individuals on the slide for their help, for providing me with information on resources that are available within their communities. We have the individuals from the Tohono O'odham Department of Emergency Management and also from the Fort Mojave Department of Emergency Response. And so just to conclude, tribes in Arizona are engaging in efforts to protect the health of their people from climate-related hazards. And of course, with these resources that are available, there comes challenges because not a lot of people have mobile phones or they don't have access to internet, so they are able to obtain like information from social media. So that is one of the challenges. So just kind of door-to-door campaigns are kind of the main ways people in kind of rural areas that are able to obtain information. And so I hope this information I provided you was informative. So I'd just like to thank you all.
Thank you so much, Renee, for your presentation. The next is by Ginny De La Cruz, and it's going to be about school water lead testing on tribal lands.
So good morning. Hello, everyone. My name is Ginny De La Cruz, and I am the program manager for the Childhood Lead Poisoning Prevention Program here at ADHS. I work in the Office of Environmental Health along with Matt and Annika. And thank you for allowing me to talk for a few minutes. Today, I wanted to talk about a new grant opportunity. And you might have all heard about this grant opportunity because my understanding is that the Intertribal Council of Arizona was set to receive some funding through EPA. And the opportunity I'm referring to is the lead testing in school and childcare program. And this program was developed by EPA with the purpose of testing drinking water for lead across the nation, across schools and childcare facilities. So this grant is we often refer to it as the WIN grant, which stands for Water Infrastructure Improvements for the Nation, Lead Testing in Schools and Childcare Drinking Water Grant. So this is a voluntary program to assist with testing for lead in drinking water at schools and childcare programs. EPA set aside $26 million to implement the program across the nation. Additionally, $4.3 million were set aside for tribal nations. In the spring of 2020, ADHS was awarded about $600,000 with the goal of building upon previous water testing efforts in our state. So in 2017, our sister agency, ADQ, had a similar program where they tested the drinking water across the public schools in our state. And in 2016, here at ADHS, we went about a similar project where we tested all the childcare facilities in our state. So currently, we're working to test the drinking water in public charter schools. Again, because we already did the childcare facilities, most of the public schools were already done in previous years. So we decided this time we're going to focus on public charter schools. So EPA has let us know that there's some additional funding available. So we decided that since there's additional funding available, we're going to go back and we're going to see maybe what schools or childcare facilities weren't included in those previous water testing projects. So we know that in 2017, ADQ had initiated this water testing project, but there are some schools that might have been left out or at that time didn't feel comfortable participating since it is voluntary. So again, since there is additional funding available, we are going to try and see what other facilities might have been missed in the previous projects and try to reach out to them. Our goal is to have a robust water testing project where we can proudly say that most of the schools in our state have had their water tested for lead. That's our goal, including childcare facilities. And the reason why I really wanted to briefly present this grant or this project is because, like I mentioned, there is quite a bit of funding available. EPA has money set aside for tribal nations. So you're able to apply directly to EPA if you're interested in participating. Another idea that was really briefly discussed was possibly having, if tribes are interested, having them partner with ADHS to facilitate this program and have schools on tribal land tested for lead. So again, these are just very early ideas, very early in their initial stage, but just wanted to put it out there, let you know that this funding is available and that this opportunity is available. And I listed here my information along with the point of contact for EPA. So feel free to reach out directly to EPA, or feel free to reach out if you have questions about the project. I'm sure I was only able to provide so much information now, but I'd be happy to talk more if you're interested. And thank you.
Thank you, Jenny. Our next presenter is Michael Allison.
Okay, as Matt had mentioned, we did have a tribal meeting 2 years ago on the NAU campus to continue our efforts to try to inform the tribal nations, Indian Health Service, ITCA, other partners on the public health tracking program and how we can engage the tribes and IHS and ITCA in this effort. Next slide, please. So there were several presentations given, and 2 of the presentations were tribal presentations. The Great Lakes Intertribal Epidemiology Center has received some funds to work on public health environmental tracking. And they gave a presentation on some work that they're doing with urban communities in the Great Lakes area. And then they also provide a sub-grant to the Albuquerque Area Southwest Tribal Epidemiology Center. And they gave a presentation on the work that they're doing with some of the pueblos in a program they call Tribal Healthy Homes. Next slide, please. Just an idea of the participants that attended. We had representatives from 6 tribes: White Mountain, Hopi, Fort Mojave, Gila River, Cocopah, and Winslow Indian Healthcare Center. The Indian Health Service, ITCA. Next slide, please. Great Lakes, ADHS, Arizona Department of Emergency and Military Affairs, and Department of Environmental Quality, and Institute for Tribal Environmental Professionals. They actually hosted us up at the Cultural Center in the NAU campus. University of Arizona, Utah Department of Health, and the National Tribal Air Association. These were representatives that attended representing these various tribal, IHS, ITCA, and state and university national associations. Next slide, please. We organized that session after the presentations into 5 breakouts, which we'll be covering separately in the following slide. Next slide, please. So the vector-borne and communicable disease roundtable mainly talked about Rocky Mountain spotted fever, which, as some of you may know, is still a infectious disease that is still impacting 6 tribes in Arizona. So some of the data needs that they talked about in that breakout was keeping track of the number of human cases, the number of house infected, and the number of dogs that are collared, vaccinated, spayed, and neutered. Next slide, please. In that same breakout, some of the data needs identified by IHS and the University of Arizona was mosquito surveillance data, animal rabies clinic data, and data on insects and number of households with pests. Next slide, please. The food safety breakout, tribal needs identified mainly were around food vendors. The number of priority violations, violation corrected on site, a number of inspections conducted quarterly and annually, number of persons who attended food safety classes, pass failure rate of the class attendees, and electrical records and reporting capabilities. Next slide, please. And that same breakout for the IHS data needs was risk factor surveys or studies, trends and violations over time, and environmental health reporting system data collection tool. Next slide, please. The next breakout was the healthy homes and places. Tribal data needs was finding resources and needing data to get resources. And with the IHS 638, University of Arizona Department of Environmental Quality data needs was better connection to federal partners and the need for home inspection reports with the IHS and the 638. Continuing with the partners data needs was the needs on indoor air quality, moles, radon, heavy metals, ash, gamma rays. There's a project that the U of A is doing with the Hopi tribe. New studies on community concerns over illegal burning on garbage, and that was with the University of Arizona. And the need for monthly updates to the My Community website. And there's a link to that community website, My Community. Next slide, please. I believe the last breakout was safe drinking water. And tribal needs was need for public water system well water data, need resources for well water contamination testing, I believe. And for the IHS University of Arizona data needs was data availability on private wells, PWS point data, safe drinking water, the governor's metric, My Community site, and a need for a questionnaire looking for exposure factors due to water at the University of Arizona. Next slide, please. I was wrong. I think this is the last breakout. Environmental emergency response. Tribal data needs were water testing on landfills, interest in ADEQ flag program, air quality south of the border, need data on illegal dumping, ADEQ, University of Arizona, list of incidents, not geographical, ADEQ, and the Hopi Tribal Indoor Air Quality Project that's in conjunction with the U of A. Next slide, please.
I think Michael disconnected.
This is Matt, ADHS. I can help just do these slides once Michael comes back. So there was a positive impact of environmental public health tracking, and we believe that there's some capacity growth to develop Arizona tribal projects, using data for different grant opportunities, communicating impact through training and policy development, and just engaging tribes in all aspects of everything that was previously mentioned. Next slide. Additionally, different awareness of resources and needs. We need data to understand Indigenous people and communities, provide access to data previously unknown or available, training on data, and then continuing to create awareness and education.
Yeah, thank you, Matt. I guess I lost connection yeah, next slide, please. Oh, yeah, the awareness, I'll go back one more slide. The participants felt that the ADHS, Environmental Public Health Tracking Program, needed to understand more the situation with our tribal people. And they were appreciative of being informed about the project, and that there are detailed environmental public health data that is available to them, and they were appreciative of that, and that if there's some toolkits that can be developed that would help them, they would appreciate it. And then also just continuous awareness and education to keep the tribal communities informed, such as the webinar that we're having today. Okay, so there's my contact information. And again, this was just a summary of meeting that we had in Flagstaff in 2019. So Annika, we can go to the group discussion. Okay, so what we wanted to do here, participants, is get your input, as Matt had mentioned, for the 2022-2025 grant period. As Matt mentioned, we definitely want to include a tribal portion to the ADHS Environmental Public Health Tracking Program. And so we've got some time to work on it. The grant document has not been released, will be released in the spring of 2022. So what we wanted to do was just get ahead of the game and just present the information as best we can, and then to get input from yourselves on how we can write the tribal portion of this new grant proposal. So again, real briefly, I did the best I could in terms of what was discussed in terms of potential projects. And then Renee did a really nice job on extreme heat. And we know there are extreme heat projects ongoing, and there's separate meetings and webinars that are being held. We can do something tribal specific. And then Jenny did a really nice presentation on the water-led testing program. So that's another possibility of writing something specific into the grant. So ADHS is more than willing to carve out some of the grant dollars and devote it specifically to tribal initiatives. but we need the projects to build the dollars around. So again, as much input as we can get now, and then between now and the submission of the grant, we'll continue to work on getting input. So the floor is open. We'll be keeping notes. And again, the meeting is being recorded. So thoughts, ideas on how we can write into the grant application some tribal specific environmental public health projects. So the floor is open. Don't forget to unmute yourself.
I think now would also be a good opportunity if there were any questions for the presenters as well.
Yes, thank you, Matt.
For Renee, I was wondering, based on your investigation into several of the different tribes and what they've been doing for heat response, are there any particular tribes that, I guess from your discussion with them, seem like maybe good partners or people in specific branches of government in those tribes that may benefit now that you've heard about tracking? And so I know that we don't have all the different tribes on this webinar, but I thought that might be a good opportunity to bring up.
Yeah, so I think the Tono Odom and for Mojave, I think they would benefit from this because I think they do partner. I'm not sure if they partner with the EPHT as far as like receiving kind of public health information.
I think it depends on the area.
Renee, we do have a working relationship with those two tribes with public health emergency preparedness. We have IGAs with them, but so far we don't have any working relationship on the environmental public health tracking.
Yeah, because I just saw based on information that I could find, I think a lot of these tribes, they kind of emphasize partnerships because a lot of them, they don't have that kind of partnerships with like other kind of government entities. So to increase partnerships to provide kind of more opportunities for collaborations. And so that's what I was able to find is just to because they emphasize increased partnerships. I think they would benefit a lot.
Hello?
Yes, hello, Madeline.
Hi, I have a question. I am representing the Hopi Department of Health and Human Services. I have any projects occurred on Hopi that, from this past grant that we're talking about? Has anything been done with the Hopi tribe? I know there's the air quality, and that's the only thing that I know of that was in collaboration with NAU and U of A. Has there been anything else that the Hopi tribe has been included in?
Madeline,
Hello?
this is Michael. Allison. No, to our knowledge, not yet. At the Flagstaff meeting, the Chief of Staff, Bruce Talama, was at the meeting and was interested, and we did have some discussion, but with other things coming up, and then, of course, with COVID, the communications just ceased. But he was at the meeting and in Flag and was interested in trying to see if we could develop a program with Hopi.
Yes, I was there at the meeting also, but I participated because I partner with IHS in the Vector-borne disease surveillance, and also to do food sanitation services surveys in the establishment here on Hopi. But I have I know that there's all the studies. I've heard that presentation where it's taken place with mostly all the tribes in southern Arizona. And you have a lot of data and information about them, but you don't have anything about Hopi. And I was just wondering if that kind of survey or information gathering would happen with Hopi so we can participate in this I guess in the upcoming grant NOFO, one of the items that I know we're concerned about on Hopi, we're not necessarily, I guess, having heat problems, but it has been a lot hotter here on Hopi, and we don't get enough rainfall anymore. And I don't know if y'all know that Hopi depends on their fields to grow mainly corn, which is the main staple for Hopi, and it's connected with all our ceremonies and our traditional activities. And we haven't had much success growing corn lately. So drought within I would say the last maybe good 10 years has been a problem. So I can't make a decision on this on my own, but I have a director. You may know him, Mr. Allison. His name is Royce Jenkins, and he's the one that delegated me to again participate in this Zoom meeting. So that's just something from Hopi.
Well, thank you, Madeline. That is excellent information. And yes, we work very well with Mr. Jenkins over the years, and we're happy that he's back at Hopi. Matt, what do you think in terms of some type of, I may be off here, Madeline, you can chime in and correct me, maybe something working with Hopi around the drought situation?
Yeah, that sounds like it could be a possible project. And I think drought has many aspects where we don't have to just think about the water table per se on the environmental side, but what are some of the other effects that are interrelated, such as fires and heat and dust storms. There are a lot of different aspects regarding drought, as well as food insecurity and food safety. So in terms of that, some direction that it could go is that with this pot of money could create some work for planning and describing the impact to get some funds to address interventions that can help towards those hazards. So the way that I see a lot of this funding is it's meant to help with monitoring and building capacity and having that infrastructure so that you can apply for perhaps some infrastructure money.
This is Madeline again. We on Hopi, we depend on the rainfall. We have dry farming. We don't irrigate our fields, but this is just a perspective from me that if this drought continues, we may have to resort to irrigation in order to continue growing our main staple of corn. So that might be something that the elders might not agree to, because, you know, it's part of our ceremonies. Almost all the dances are or prayers for rain for our cornfield. So it might be a study or a survey first to find out how many people would be interested in irrigation. Right now, we have a slow drip garden nearby my house, but even that, this past year, I don't know what it was, but nothing grew. It just didn't produce anything, and almost all the farmers here in Hopi, and it was related to no rainfall too, but nobody hardly harvested. It was so sad. But anyway, just a point there. I don't know what the feeling would be, because that's just a part of our traditions and prayers that, you know, our ceremonies are done to pray for rain. So just a comment for you all.
Thank you, Madeline. That's what we need, and that's what these sessions are for. Is the dollars are here. The state is using it in this certain way, and for time being, it might be apples and oranges, you know, but we're trying to make them both apples, both oranges, where the tribes can benefit also. So we just need to keep talking on potential project, and then keep working at it, and then eventually have some good tribal project where the tribes can be benefiting also from this environmental public health tracking. just to add to the discussion, we did have some interest also from White Mountain in terms of the fires that take place, and the mainly was from the smoke. And we know that the tribes in Oregon are participating in environmental public health tracking, where they're working with the state of Oregon, might be the state of Washington, to track data in terms of the impact of the smoke on the community. So yeah, what we're trying to do again is just get some ideas from the tribes participants as best they can, understanding environmental public health tracking, and propose some potential projects. So thank you, Madeline.
I also had another comment, just on the research I found or was able to find. So funding just kind of came up, funding to support kind of communities in Arizona in the development of vulnerability assessments, adaptation plans, emergency response plans, and just plans that address drought, heat, and possibly flooding. And so kind of besides that, funding is a concern, and they do have people that are available that are willing to write these plans or assessments. However, there's kind of that lack of funding to train the individuals on how to write these like grants or these kind of plans. And so I just wanted to comment on that.
These sources of technical assistance are for emergency preparedness?
Yeah, just like vulnerability assessments, adaptation plans, emergency response plans that just kind of address, drought, heat, and stuff like that, kind of the natural hazards.
Okay, good. Are they federal sources of the grant writing?
I believe so.
Okay. Yeah, I think that's definitely a part of the work we're trying to do. And I think going back to the Flagstaff meeting, when the groups were talking about resources, just having that available. And it may not be as widely available as, maybe we think or maybe should be. So any information like that, we can disseminate that information. It just gives me a thought. Maybe on the environmental public health tracking website, maybe we have a tribal component, and so recommendations that or additional information that, for instance, that you just gave us, Renee, could be put on that website, and people could have access to that information and that they may not have known about. Matt, what is your thoughts on having a tribal component to your website?
I think that's really easy enough, and it would be a way for us to put everything into one area. We can create another box or thumbnail that the web team could create. And I think along those lines, it would be a good opportunity to put perhaps future meetings, the recordings, to somewhere people can go. Because I can imagine that before we apply for the next grant, it'd be good to have another meeting similar to this, well in advance before we write, to just plan out things of potentially who would help us want to write the grant application. So just spitballing things, I would imagine sometime in the winter, maybe December or January would be around that time to framework things. But I think that's a good idea, Michael, to have something where we can refer people to for a website specific for tribal environmental tracking.
Good. And then how, Madeline, how should we follow up on the possibility of maybe a environmental public health project with Hopi on the drought? And like you said, maybe be a survey, but of course, the Hopi tribe would be in control and would make all decisions. How do you feel, Madeline, that you want to talk to Mr. Jenkins first and then maybe get back to us? Or do you think we should just have a Zoom call with yourself and other staff and Mr. Jenkins?
Yes, I believe a Zoom call that includes Mr. Jenkins and possibly Bruce Dalwaima to bring him up to speed on, or just refresh his memory about the last meeting and get some feedback from them. They're they're the leaders and Royce is the director of our department. So yes, I think a Zoom call would be the best thing to do.
Okay, great. So Madeline, shall we wait and let you follow up with Royce and Mr. Kalamaya before we set something up?
Yes, and there might be possibly other tribal program directors or supervisors who Mr. Jenkins feels will be best included in the call.
Okay, so we'll wait till we
So
hear
I can
back
do
from you,
that.
Madeline.
Okay, who do I contact?
You can go ahead and contact either myself or Matt.
Okay, I'll do that through email. I have both of your email addresses, I believe.
Great, great. Yeah, and so Mr. Jenkins and I we go way back working together, many years.
Yeah, he's mentioned that.
And then Renee, I think we can also follow up with Thana Atom and Fort Mojave. I know on another project somewhat related to environmental public health was in the area of emergency preparedness was the flooding issues that the tribes encounter. If you might remember, the Salt River Casino was all flooded. I think a couple of years ago, and they weren't necessarily prepared for that flooding. And I think Ak-Chin also experienced some damage from some flooding on their community also. So I think maybe we can reach out to Donna Autumn and Fort Mojave, and maybe also possibly something on heat-related illness if they might be interested on that. So what are your thoughts, Renee?
Yeah, I think they'll be willing to participate. They were very willing to offer me information, so I think they'll be willing to participate.
Yeah, I just know that, we know the tribes are underfunded across the board and just got so much that they're dealing with. And then we know everybody's just digging out from, or still digging out from COVID. And just, it's still the number one priority, we know, with the tribes. And we're aware of that, and we'll be very respectful of that when we reach out to the tribe. I guess, Matt, we're now wrap up.
Yeah, so thanks. We're on our next steps and closing remarks, and I want to thank you all for attending this webinar, and we recorded it, so if there are others that you would like to share this with, after this we'll send a copy of the slides and the recording when it becomes available. It'll be a YouTube link, and we're going to post it to our website, azdhs.gov/EPHT. and send it to all the registered attendees and those that attended the 2019 meeting for awareness, because we know that COVID is going on right now and a lot of people are doing double duty. So we appreciate the time that you took to attend this meeting. This will not be the last meeting. We plan to hold another one meeting, as I mentioned earlier, probably in the winter time. Hopefully we'll know more about the grant then, and hopefully also that we can have a clear picture of a partnership to better advance environmental health and reduce adverse health outcomes. So I want to thank all the speakers and also facilitators for this meeting, and hope you all have a great rest of your day and great week. All right, bye everyone.
Thank you, everyone.
Thank you.